Welcome back to Medical Monday. I have Dr. Nancy Peacock from Tennessee Oncology here with me today, trying to sort through breast cancer. Gosh, we talk about it so much, and there are so many questions when it comes to breast cancer, and I think so much fear when it comes to any type of cancer, but for women, it's breast cancer. I think that you see your colleague go through it, you see your mom go through it, and it just creates this fear that we all live with, whether it even be a little bit small. If you do get that diagnosis, or a loved one gets that diagnosis, what should you expect from your caregiver?
Oh, that's a great question. Well, I think just to be supportive and listen. You know, we all want to fix things. We all want to fix things for everybody else, but you just have to listen and help and let her trust in her decision-making ability, because there are a lot of things to think about and understand. I've always found it this really unique situation where a woman walks into my clinic and she has to be able to trust me. First of all, decide if she can trust me, and secondly, be able to decide if she can understand what I'm saying and will agree to do what I'm saying, and usually all in one visit. I mean, it's a lot. It's a lot for somebody, and I think about my reaction if I were in that setting, and I would not be as gracious as so many of my patients are, and I think, boy, that's a heavy burden for people to carry. But I think that when they do have a caregiver with them, that person, just to be there with them is so important, because, you know, the other thing that's really important for women to think about, they come in and all of a sudden they think their lives are over, they're not the same person they were. You know, sometimes they think they're a little bit of a freak compared to what they were, may not have even had surgery yet, but oh my gosh, I've got this mark.
Right.
And I try and tell them that they're the same person they are today that they were yesterday or last week or 3 weeks ago when they were on vacation and had no clue about this. And I think that's important to keep stressing to people, because they don't want to be defined by breast cancer. They don't want to be defined by any cancer.
All right, let's take another call. We have Annette on the line. Annette, thank you for being with us today. What is your question?
What's that file in Dr. Point?
Oh, Annette, I don't think that we can hear you real clearly. We'll see if we can't have our producer talk to you and get your question a little more clearly, and then we'll try to answer it. But thank you for calling. We'll get to that question if we can get it figured out. Hang on just one second. I do want to talk to you, Dr. Peacock, about that caregiver setting, and you go and meet you for the first time around. You know, there are a lot of people who provide cancer care. How do I know I'm in the right place, and this path that you line out for me and say, this is what you need to be doing? How do I know that's what I need to be doing? What questions should I ask as a patient?
Right. Well, I think it is important to do a little bit of research first. A lot of times when I see you, or any oncologist sees a patient, it's because somebody they trust has sent them. So either their primary care doctor or their gynecologist or somebody that they've had a relationship with says, I know this person, go see them. So at least from that perspective, they can feel a little bit more comfortable. But I do think that women need to ask, how is this going to impact my life on a day-to-day basis? What kind of scheduling is this going to take? What are the medications that you propose to give me? Why do you want to give them to me? How much is that going to help me? Can you prove that? Because it's a hard concept for us as oncologists to explain and patients to understand.
Sure. And
they want to really try and understand all of it. But I think that there are some really great websites out there. I refer people to the National Cancer Institute's website. You've paid for it, you might as well use it. It's nci.gov. And also the American Cancer Society has a really patient-friendly website. I sound like I'm doing a commercial for the American Cancer Society tonight, but they have been huge in terms of advancing cancer care in this country.
You know, and that's what so many of us do, whether it's the common cold or something like cancer. The first thing we do is go to our computer and start typing in terms and symptoms and how do we, you know, and we see what it comes up with. So it's where we turn these days to get answers.
Sure. So cancer.org and nci.gov are the two you want. Don't get it off Wikipedia.
There you go. You heard it from a doctor. Wikipedia is not the place to go for medical information. Actually, I just heard from our producer. She said Annette was asking, how do we get an appointment to come see you if we've been diagnosed? Is it something we can call Tennessee Oncology and say, I need an appointment, or does it have to
Yes.
come through referral?
A lot of time, it depends on the insurance company. Many times insurance companies will make you have a referral, but if you've got that information when you call, then my front office staff knows how to sort through that and,
Okay.
and help that process along.
Yeah, you know what? Just dealing with insurance through any type of cancer diagnosis is a lesson in its own. You have to become this expert.
Yes, you do, and it really does take a huge and extraordinary effort by a lot of people who work in our office to get that done. You know, it's great that girls are mostly girls. There aren't all girls, but the women that work at the front desk, the people that work behind the scenes. There are a lot of people rowing that boat, trying to make sure that we're not bankrupting patients, that they are able to stay on their feet financially. It's a really hard situation for a lot of folks, and we're very aware of that.
That's fantastic. Let's talk about that treatment, and we've talked a lot of about different drugs and chemo and radiation. Beyond that, as a doctor, what other components do you see proving successful when it comes to treatment in someone's life?
We use a lot of supportive care services. I think that the two that we forget about, and then until patients are really just struggling hard, we've got great psychologists, so we have psychosocial support that see nothing but our patients and their families. And so they work, they're two PhD psychologists, they're great women, they do a nice job, and most people are always glad they went. We also underutilize physical therapy a lot, I think. And we have, at every hospital that we have physicians working in, we have physical therapy for our cancer patients. And we need to remember to use those programs, because after surgery, after radiation, after you feel crummy from chemotherapy, it's really important to try and get people back in the swing of things. There are great resources in the community for support, like Gilda's Club. Also, the American Cancer Society and the YMCA put on a program called ABC, After Breast Cancer, to get women working with trainers to get them back where they feel comfortable walking into the gym on their own. They also have some other components to their programs, but those are important for my patients.
You know, I had a friend who's a personal trainer who did his graduate work in doing a study on exercising through breast cancer and after treatment, and just showing the benefit of it. And it can be so hard when treatment can make you feel so crummy.
Right. If somebody's getting chemotherapy, they do feel crummy.
Yeah.
I try and get them to get up off the couch at least for 10 minutes a day. You know, the other thing I tell them is that they shouldn't be disabled by their chemotherapy. That's not, that they should never feel that way, but they will feel tired. They're going to have to adjust their schedule a little bit.
Okay. Don't forget, if you have a question, now is your chance to call. You can talk to Dr. Peacock right now, absolutely free of charge. You don't get that with doctors very often, so give us a call, 615-737+. We are talking breast cancer tonight. Any questions you might have on that topic, please feel free to give us a call and call in. Again, what do you see on the horizon when it comes to treatment, when it comes to even curing breast cancer? I know you said maybe in some areas of breast cancer we can think about a cure, but maybe not all.
I think that we're going to be able to detect the very smallest circulating tumor cells in a meaningful way. There are assays or tests out there now to detect these little circulating tumor cells in the blood to try and decide if it's better to treat earlier rather than later. I think that they're not necessarily accurate enough just yet, but I think they can become tools of the future. And so I think we'll have some help in that way. And I think that there are some other really specific molecular biology techniques that are going to help us. We can detect little bitty splices of DNA, little bitty bits of it that are cancer DNA, that we might be able to make a probe to mirror that, bind it to that that cancer DNA and just pull it out of the circulation. You know, just kind
Wouldn't that be
of wash your
amazing?
blood.
Wow.
Yeah, and of course we're years and years off from that, but I think that will come along.
You go ahead.
I think the immune-based therapies are really exciting too, and I already talked about that just a little bit, but those are going to be huge. And it's interesting because 30 years ago when I first started in my training, there was a professor at the National Cancer Institute who based his whole career on trying to make T cells, activate T cells to get them to work against malignancies, and he had 1 or 2 successes, but it was hit or miss. We didn't have the tools we needed back then to be able to develop the right technology, but now we do, and I think we're moving forward.
What made you interested in to go into this section of you know, and to study breast cancer?
Well, I think that I trained in a program that did a lot of breast cancer research, and that was one of the big influences. I had some very good mentors who had a huge interest in breast cancer treatment and research and everything else. I also, when I moved to Nashville in 1995, there really weren't a lot of other female oncologists. There were just maybe 2 or 3, and females were just starting to come out of their training programs in internal medicine, OBGYN. That was sort of the era where the medical school class was made up of 50% women. And female physicians wanted other female physicians to send their patients to, especially their female patients with breast cancer. So it was sort of a natural evolution, and it's been kind of interesting to watch that in Nashville because there have been so many new and great female physicians added to our group and to a lot of other groups.
There is a comfort level, I think, for most women to see another female doctor, and especially when you're talking about breast cancer, just something so sensitive.
Right, I agree with you. Which is another interesting point, if we have a few minutes. When back in the 60s and 70s, we didn't have screening mammography. And women were very afraid to go to a doctor because they knew that the surgery, by the time they felt a mass, it was big. They knew that the surgery they would have to have was going to be big and disabling. And they knew they would go into the hospital for weeks and sometimes months at a time to recover from that operation. There are historical recollections of all that through the medical literature, and I think it's so interesting to read it because you think, oh my gosh. So women wouldn't talk about this. They wouldn't talk about breast cancer, and it wasn't until Susan G. Komen and the whole advocacy movement really got going that women felt empowered enough to start talking about breast cancer and not feel embarrassed by it and realize, hey, if we put our brains behind it, maybe we can figure out some solutions.
Look how far we've kind of really a short time when you look at it. I mean, 60s and 70s just to now.
Right.
Wow. All right. We're going to take another quick break. If you got a call, give us a call during the break. 615-737. Plus, we would be happy to take your questions on breast cancer. So give us a call. We'll be right back.